Hi, hello, and welcome to all for this exciting 45-minute NEET PG masterclass. I hope you're all excited, just as much as I am. Okay, let's get started. I want to start at 8:15 so that we can finish it at exactly or before 9:00 p.m. So that's 45 minutes, right? Yes. So let's get started with this Operation NEET PG. No anesthesia, no blood, just strategies, right? I'm super excited to share my journey with you all. Let's begin. So, a small intro about myself, just a few lines of myself. So, I got All India rank 470 in the recently concluded NEET PG 2025. I did my MBBS from MS Ramaya Medical College, Bengaluru. I am a thorough surgeon at heart. I don't think I can take any other branch other than surgery. So if you all are wondering what I might be taking, you got your answer. And I am your senior buddy, sharing my journey with you all. And let's get started. Before we start, I just want you to know some ground rules before scrubbing in to this Operation NEET PG. My first and foremost humble request is trust me and attend the session with an open mind because we all know no one can fill a glass that's already full. So listen to me with an open mind and you can follow it or you can see what's best for you. Yes. So keep a pen, paper, just to make notes of, some important points that you might feel, a bottle of water and any snacks. Just sit back, relax and enjoy this session. And imagine it's like one-on-one talk between a senior and a junior. Feel free to take screenshots of any important slides or any stuff that might you might come across on the screen. Okay. And every point here that I'm going to tell you is very important because I have made sure I want to tell you a lot of work has gone into this to concise what I want to tell within 45 minutes so that I spend the least amount of your time and give you the maximum that I can give you. Most of your doubts here will be resolved because I prepared this session based on a lot of questions that I used to have it preparing. And life is a journey of questions. So, not that I've cleared all my confusions now, but I'm going to tell you things that have worked for me. And it's also based on a lot of FAQs that were asked to me after the results. And individual doubts are totally welcome in the Q&A session that we'll be having post the session. And I just want to make one thing clear that I'm not going to focus on any single platform. Yeah, I've used a couple of platforms, but this session should be useful for everyone preparing from any platform of your choice. These are general ideas that can be applied to any platform, and you will have a very enhanced strategies for preparation. Let's start. So the first and foremost thing before you get into battle is you should know your enemy, right? Test the exam before the exam tests you. Got it? So let's see what this exam is. So we've got two important exams here, NEET PG and INICET. So NEET PG is for all the colleges in India except for the central institutes, which includes a lot of the AIMS and JIPMER, PGH Chandigarh, NIMANS, and a couple more colleges. And NEET PG is for all other colleges. So both are MCQ based exams. I'll tell you all the basic details about the exam. Both are MCQ based. Both are computer based tests that are held once a year if it's NEET PG. And INICET is held usually twice a year. Okay, once in May and once in November. NEET PG has 200 questions, 40 questions divided into five sessions, with each session lasting 42 minutes each. Okay, so totally you get 3.5 hours that you need to give your exam. This pattern might vary. Okay, later on the pattern might change or whatever, but this session will give you points to prepare for any kind of battle that you're going to face. Okay, So NEET PG, the marking system is for every correct answer you will get +4, and for every wrong answer you will get one negative marks. Unanswered is 0. So totally the exam is for 800 marks. Got it. NESET is an MCQ exam, again computer based, twice a year. We already saw that. Again 200 questions, but the difference is the time that you're attempting the exam. This is only 3 hours, while NEET PG was 3.5 hours. Okay. So here you have more questions that needs to be solved in less amount of time. And for every correct response, you will get +1. And for every wrong response, you will get -1/3. Okay. And unanswered questions are going to be 0 again, total for 200 marks. But just knowing, these data can be seen from anywhere. So this is not called knowing the enemy. This is just looking at the external appearance of the enemy and you think you know the enemy. No, we are going to dissect this enemy part by part and we are going to beat this enemy. So the first thing that I would like to tell you all is the question trends that are asked in all these exams. So clinical integrated questions are focused more than just plain one-liners. So clinical because it most of the questions that come in these exams are like a patient is presenting to you, like a patient comes with so and so complaints, and what is your diagnosis or what is the first most important investigation that you would do for him or her, and what is the drug of choice, and the questions revolve around these. So no one's going to ask you drug of choice for Huntington chorea is dash. No, those times are gone. People have become more competitive, and the exam body has to make it more competitive. Okay. And one liners, as I told you, are not going to be focused. You need to focus more on previous year topics. Okay, that is called knowing your enemy. Okay, you should know the moves of your enemy, every move of your enemy. Okay, so focus on previous year topics more than previous year questions. It is highly unlikely that the questions might get repeated exact word to word. Okay, but all the questions are going to revolve around some common topics. Like, for example, someone in one exam, okay, the question might be on PCOD. Okay, one question might ask about the ultrasound criteria of PCOD diagnosis. Another question might ask what is not there in Rotterdam criteria or something, but it's going to focus on this topic, PCOD. So, right here, you got one topic which is very important in your exams. Let's master that. Okay. And INICT focuses a lot on basic sciences, which is going to include the first and second year subjects, okay, which includes anatomy, physio, and so on. NEET focuses more on your clinical subjects, okay. Then we have total 19 subjects to study. So here is where a lot of, my controversial ideas might start. So let's get on with it. So I would want you to, look at these 19 subjects and categorize them into these categories. So if you see on various platforms, the categorization might vary, but this is the category that I would like you to follow because major subjects we all know medicine, surgery, OBG, and PSM here is community medicine, preventive and social medicine. And minor ones, we know, yes, derma, anesthesia, radio, psych, and whatever else is there, minors. Okay. One thing I would like you to notice is pediatrics is added in a minor subject. Usually we write one entire paper in university exams for pediatrics, right? But that's not the case in NEET PG because the content that is tested under pediatrics is quite less than you would expect. So I would categorize it under minor. Okay. And intermediate subjects, you can see that I've put an asterisk next to a couple of subjects there. Okay. So intermediate subjects is categorized into these 6 subjects, but anatomy, physio, biochem, and micro, after I would say 1 or 2 rounds of prep of these subjects, you can categorize these as minor subjects too. I know these are the controversial statements, but trust me, you will realize it when you follow these. Okay, so please, I would recommend you take a screenshot of this screen. Okay, I'll move ahead. So these are the number of questions that are asked under each subjects in NEET PG. According to year wise, I've categorized the number of questions. I haven't added 2025 yet because we have to get exact proper recalls yet. So these are the number of questions that I've asked, and you can see the weightage of certain subjects based on number of questions asked. So please take a screenshot of this slide too. and this slide, which has the other remaining subjects. So please take a screenshot of these. Right. So moving on. Next thing I would like to tell you is you should find yourself a high yield treasure map. Okay. Create for yourself a very high yield treasure map because you shouldn't dig the whole mountain when the gold is in one corner. Okay. So this is based on the Pareto principle, which tells 80% of the questions come from 20% of the topics. I'll read it again. 80% of the questions comes from just 20% of the topics. So the top six high weighted subjects that we need to prepare are medicine, surgery, OBG, path, pharma, and commed. Okay. So that is 20% of less than 20% or something of entire 19 subjects. And under these subjects, 80% of the questions are going to come from just 20% of the topics. I'm telling you, trust me, this is the truth. Okay. So we are going to have 10 to 15 must read topics in every subject. Okay. So let's look at the higher end itself. 15 topics we have and 19 subjects. So multiplying it, we are going to get 285 topics. Okay. So we are spending close to 6 years in our entire MBBS. And here we have less than 300 topics that we need to, you know, get the mastery of to assure yourself a wonderful rank to chase your dreams. And 300 topics. Okay, you just master one topic per day. Even in 1 year, you're going to master the entire things that NEET PG needs, for you to crack this in the best possible manner. That is how easy NEET PG is. Trust me. Next one is study smart and not just hard. So smart and hard work always yields results. I'm not reading the next line, but you get the point. Okay. So it's not about the hours studied, but the hours remembered. Okay, so we are going to look at some things here that I would say is smart work, which again, a lot of what I might tell might be controversial compared to other platforms. But yes, so university exams and NEET PG, I would say both are important in their own sense. Okay, I cannot give you an answer which is more important, but NEET PG is important because that's going to give you a PG seat, right? But university exams are important because they come periodically every year, which will ensure that you finish those subjects in that time, right? But if you haven't finished your first and second subjects, just hang in there. Don't worry, we'll come to that very soon. Okay. So university exams and NEET PG, the important topics differ quite a lot, I would say. Okay, I'll give you an example. In ophthalmology, okay, third year university paper, the topic of squint does not have much weightage. It's almost always a given thing that, okay, if I don't know anything in ophthalmology, for the university exam, I'll read this difference table, the difference between comitant and non-comitant squint. Okay, this table I'll just read and go. I'm assured at least 3 marks. Okay, so this is how we go. That's all the weightage of squint is in university exams. But the topic of squint is very, very important in exams like NEET PG and INICET. Okay, so we have a lot of concepts under squint that are tested, like Words 4 test, or amblyopia tests, or Park's three-step principle. A lot of these are very important, okay, which we don't really give focus on during our university exam preps. Okay. Next question that was very commonly asked is, should I follow standard books? Yet again, another controversial reply. Standard books have been standard for quite a long time. Okay. Now we're in the age of technology. So we have a lot of coaching platforms and a lot of sources which have, squeezed the essence out of these standard books and giving it to you in the most palatable way possible. Okay, when you are getting that, ultimately, when you're treating a patient, the knowledge you have about the subject is what matters. It does not matter where you obtain that knowledge, right? So, if you have not much time and you have to choose between, the easier version, the more palatable version, and standard books, I would always tell you go for the more palatable version and don't spend time on standard books. Okay, but always standard books are so beautiful to read. If you have time, do check them out. Okay, yes, got it. Next, how long to study? It's a very individualized question. You can custom make your time according to how much you want. Um, so I would give you an estimate like, okay, very close to the exam. Okay, say 3 months or something close to the exam. Try to put in at least 10 hours per day. Okay, you've got to do this. Okay, before that, it's totally up to you. You can plan your day according to how much time you want to put in. You can plan your week, you can plan your month. Okay, I will go and put in a lot of time on one day and I'm going to enjoy for 3 days. That's up to you. It's in your hands. Okay. Now, how to finish the pending subjects from the previous years? This is a very, confusing question that has always bothered me throughout my prep too. Okay, this was also there in your the message that I sent you. Like, if I'm not studied anatomy, should I start there or what? Okay, so I would tell based on the year that you are currently in, finish that year's subjects the best. Okay, once you finish that and you have a decent hang of it, okay, go forward and finish some other subjects that you feel are weak from your previous years. Okay, but you shouldn't do that at the expense of not mastering your current prof subjects, right? Now, main videos, shorter versions. This is again one more question that I keep getting asked. Okay. So, main videos are shorter versions. So, shorter versions are definitely preferred if you have less than 1 year for your exam. Okay. Main videos, you need not watch for all the subjects, but at least for those, 80% of the topics, 80% of the questions that come from 20% topics, I would recommend you watch the main videos for those 20% topics at least. Okay. If you have time, well and good. You might go ahead and watch standard videos or main videos. So preparation along with internship is a very big thing that needs to be addressed because a lot of us are confused. Wait, should I, compromise my learning skills in internship and spend time on studying? Or should I be like, okay, in internship year, I will try to become a good doctor, okay, and then take a repeat year and prepare for NEET PG. Okay, I feel preparing along with internship helps you a lot in internship, and internship in return helps you a lot in preparing. Okay, let me give you an example. So I scrubbed in one undescended testis surgery. Okay, when I was posted in pediatric surgery, and when I followed up that case, no, the entire concept of how to approach a patient with undescended testis, unilateral or bilateral or whatever, became crystal clear. Post that, I did not even revise. That was how much clear it became because I saw the patient and I was very thorough with what needs to be done. So that's how I would tell preparing with internship. One more point I would like to tell you is you can plan your day in such a way that you wake up early and you finish probably like at least 1 hour of studying in the morning. Okay, so when you come to internship in your hospital, okay, you are already in confidence that, oh, I have done something very well already in the day and I'm ahead by one step. Okay, and then you can enjoy your internship, learn your internship of skills in that day, and then if you have time in the evening, you can go back and study. Or if you decide, okay, I'm going to chill with my friends today, you can very well go ahead and do that because you are happy. Okay, I spent at least 1 hour today, and I can do much more in the week or later next week or something. But please, if possible, develop this habit of waking up early, finishing at least 1 hour of studies, and then going to internship. Okay. So, one philosophical quote is that you have too much time, but too little time. I wouldn't elaborate that here, but I guess a lot of you would have realized this in very many different exams that you have given. Okay. So, notes, okay, your ultimate weapon. A sharp sword wins before the fight begins. So, notes are your personal survival kit. Okay. So, should your notes be beautiful? Okay, you can see my first point, the spelling of beauty, missing an A. Okay, I want to tell, like, what I want to tell with that is a lot of you realize that the word beauty is missing an A more than the entire decoration that's there on your slide. Okay, so the point here is that the content of your notes is what is most important. It need not be very beautiful with some very, colorful diagrams or the best calligraphic handwriting possible. No, not necessary. It just needs to be legible for you to read. Okay, and this is one important point that I would like to tell is have one notes, okay, one place. Okay, it can be from any platform. You might use one platform for medicine notes, one platform for surgery notes, but use one notes. Okay, so that notes is going to be like the skeleton notes. Okay, which is going to have, like, say a nursery kid has a book which tells A for apple, B for ball, and so on. Okay, have the skeleton book. On this, you're going to add A for ant or A for antelope. It's totally up to you. Okay, suppose you have notes for, say, mm, leukemia. Okay, leukemia, you got all the points there for ALL, AML, CML, CLL. You got a set of points, 10, 15 points in the skeleton notes. But if you next give a Q bank or test series, which we will address later on, and you find some new point which you think is important, add it there. It will become your 16th point. Instead of, if you're making your own notes, that will be your first point. Okay, so that's why I would always prefer ready-made notes over handwritten notes. Okay, true. Handwritten notes means it'll, you're writing and reading at the same time. All those inputs are going, but times are changing, guys. Technology is evolving. You have to evolve with technology. Okay, ready-made notes are there for you. Skeleton notes are there for you. Add over that. Okay, and be very mindful of, okay, if you want to prefer handwritten notes, okay, or you're adding on ready-made notes, be very mindful of what you're putting in the notes. Okay, if I have to write A for apple and I'm going to write spelling as APPLE, later I should be very confident that 99% I wouldn't have made a mistake while writing the notes. So if I get a confusion later on, is this answer correct or that answer correct? I should be confident that when I wrote the notes, 99% I wouldn't have made a mistake. So I should believe my notes. You got my point? That's the thing. So notes from standard books, again, I had already told you that, that's notes from standard books is what multiple coaching platforms are giving you. So you don't need to really make notes from standard books. And trust me, all these things that I'm telling you, these mistakes I have done. Okay. So notes from seniors or Insta influencers, if you feel they're helpful, you can very well go for it. But again, take the content which is only extra from your skeleton notes and add it to that main notes. Okay. Now, this 20th book concept is a very, very important thing because 20th notebook is a very personalized thing. Okay. I will be elaborating it later on in one of the videos on YouTube that I may post later. But here I would just give a brief idea of it. 20th notebook is a very personalized thing because each of us are weak in different parts of the topics. Right. So only that weak things that we keep making mistakes on should go to this 20th notebook. The most volatile things, like one of my friends might be very good in remembering the entire classification of cephalosporins, but I might struggle. If I feel that is important, trust me, that is not really important. But I'm just giving an example. If I feel classification of cephalosporins is important, I would add that to my 20th notebook. So 20th notebook, please do not take from any source. If you want to create a 20th notebook, you have to create it by yourself because it's a very personalized thing. Okay. So this is an example of my notes that I wrote. Not the most beautiful, not the most calligraphic handwriting, but if I have a view of this multiple times, no, I would know, okay, what is the content of this notes. Okay. Yeah. So the art of revision. Okay. Revision turns knowledge into reflex because that's what we need. We saw the timings of the exam. Just 3 hours, you need to tackle 200 questions, or 3.5 hours in NEET PG. You have to tackle 200 questions, which are going to decide a lot of things in your life. Okay. So let's make it a reflex by revising it multiple times. Okay, so number or quality. So some might ask me, okay, I'll revise it very, very fast. I'll revise all 19 subjects within, say, 2 weeks. Should I do that? Or I will revise just once, but it will stretch for entire, 1 or 2 months. Which is better? You need to have a balance between both. Both are not the best things. Okay. You need to have balance between both, where you will, when you reach the point of revision, you will know that what is the thing that works for me. Should I read it fast, just go through it fast, or should I spend more time and get the concept right? Okay. Revision doesn't just start when you finish all 19 subjects once. Revision starts every other day. That is called spaced repetition. You study one thing today, just revise it for, 1/10 of the time that you spent in studying that the next day. Okay. Third day, seventh day, 21st day. Okay, have a spaced repetition schedule and revise what you have studied the next day. Okay, and what is the priority? Okay, which subjects are priority? I have already discussed to you with you what is the priority subjects that you need to focus on, and you have to have the priority as those topics which you are weak at. Okay, so again, that's a very personalized priority list. So you need to make the priority list yourself. Okay, you can use a lot of these techniques like active recall, which is also involved in spaced repetition. Okay, the Feynman method, which is like you understand a topic and you explain it to one more person. So if you have to explain it to a 10th standard kid something medical, you need to break it down to the simplest of terms. And if you can achieve that, no, that is the level of understanding you have. Okay, be proud of yourselves, right? And Anki flashcards. Flashcards are a very good method of active recall and spaced repetition. And quizzing. You can either attend quizzes, okay, or you can quiz yourself or your friends. I have learned a lot of these things, and it's in my memory because me and a couple of my friends used to ask each other, okay, what is the answer for this, what is the answer for this, just chuma randomly asking questions. Okay, but I would, if you want, I'll upload videos very detailed on these methods. Okay, personal, especially for NEET PG kind of preparation in my YouTube channel very soon. So MCQs. Okay, this is an MCQ exam, guys. So we need to crack and decide how MCQs have to be dealt with. Practice makes perfect. Answering MCQs is a skill. It is not luck. If you have four options and if you're going to buy luck, get a 25% chance that you're going to be right, that is not the case for 200 questions. You might get in one or two questions, but no, people are getting right answers in MCQs because they have cracked the code of how to solve MCQs, and that is exactly what we're going to do now. Okay, so testing yourself before the real test is learning. It is not testing. Okay, when you're attempting questions in the Q bank, or you're giving mock tests or grant tests, view that as a learning tool. Please do not use it as a yardstick for measuring how much I have progressed, or look at the scores and be like, oh my God, I'm putting so much effort and why am I not progressing? No, it is a learning tool. Even a lot of these coaching platforms, they give so much info in their main videos, their notes, and then they expect you to get more, information from the Q banks or the test that they're conducting. So the platforms themselves know that you are not going to get 100 or 100 on anything of these, or even not even 80 of 100. Okay, you might get even 20 of 100, and you will get, but you are getting 80 new information that you can add to your skeleton notes. Okay, that's the point of view that I would like you to have, right? So tests, how frequently do you want to give? So tests, no, in your second year or third year, I would tell, once, say in 6 months, just two tests you give per year. Okay, just for the feel of it. Okay, you're now going to get a very great score in your second or third year because a large chunk of subjects in your 19 subjects is in the final year, right? And even in final year, a lot of us are not very good in final year subjects also. So probably internship is when you can start seeing a spike in your grant test scores or any test that you approach. Okay, so as in when you reach internship, I would recommend that you keep giving the live grant tests as and when they come. Okay, or if not possible, at least once a month give a grant test. Okay, very close to the exam, like say 3 or 5 months close to the exam, start giving grant tests. Less than within 1 month, can be 3 weeks once or 2 weeks once, up to your comfort. Okay, but very very close to the exam, say just 2 weeks before the exam, please do not give a single grant test. Okay, it might come very good. You might score 180 right out of 200 questions and be happy, or you can become overconfident, or you can do not so well in that and lose confidence. Remember, the key when you're attempting the exam is more than content, is confidence. You have to go into the exam hall thinking that I can crack any question that's coming there. Okay, doesn't matter what knowledge I have, what I have read or not read, but I am going to find some clues in the question and eliminate stuffs, eliminate options, and crack that question. Right? And never kill two patients with the same mistake. Okay, if you're making a mistake in any of these questions that you attempt, please make a note of it, and please make sure that you don't make the same mistakes again and again, because we have a lot of mistakes that we are going to do anyhow. Okay, we need not add that repeated mistakes to that list, right? Analysis and mistake book is a very integral part of solving these questions, because analysis is especially for your tests. Okay, analyze which are your weak areas, which are your weak subjects. Okay, I know a lot of coaching platforms give you a very good analysis table, or the questions that you have guessed and got it right or got it wrong. A lot of these things you have. Okay, look at the analysis, or the data that you get in your coaching platform, and try to make the best use of it. Okay, I'll also upload a video in future of how to analyze tests. Okay, we can go forward. Now, elimination, as I told you, you can eliminate out of four options. Trust me, a lot of questions will have one or two options which are absolutely crazy. Okay, for example, when a patient comes to emergency and you want to give some drug, no, it's very, very most likely that you have to give it through IV route, and you're not going to give it oral to a patient who is unconscious, right? But oral route might be an option in your MCQs, so that option is directly ruled out. So you just have to deal with three more options. That makes life so much more simpler. So focus on elimination, focus on the keywords in the questions. Okay, you can get same PCOD example I'll take. You can have hirsutism in the women. Okay, excessive growth of facial hair, all those things, infertility or irregular cycles. These are all keywords. These words will be entangled within very complex sentences. Okay, so you're going to pick out those keywords and do these. If you have questions which you have no clue of what is asking, okay, that's where the art of intelligent guessing comes. Okay, use all this knowledge that you have. Okay, rule out options like, okay, this is comes in that disease, might not come in this disease, so probably this is not an option. Eliminate it. Okay, and if you can eliminate two options and you have just two more options to deal with, go for it. Okay, even if you're not sure, don't worry about negatives, go for it. Okay, next, the daily target, it was again a personal choice, but I would tell you, close to the in internship or 1 year when you have before exam, solve at least 50 questions in whatever topic that you have just learned. Okay, rest is up to you. If you can solve 200 questions per day, you're great. Okay, but minimum 50. So next, the doubt box, clearing confusion. Your confusion today is your clarity tomorrow. Okay, every student has the same doubts. The toppers just clear them faster. We have heard this quote: "A stitch in time saves nine," hundreds of times from our primary class. Okay, but that is so much more, so much applicable here. Okay, if you have a doubt, please clear it then and there. Okay, don't postpone that. Don't be lazy in clearing your doubts. Okay, don't hesitate to ask around people to clear your doubts. Okay, read. Okay, get doubts, put an effort to clear it, and once you clear your doubts, no, trust me, the happiness you get and the awe you are of this wonderful field of medicine, how beautiful it is, you will appreciate it, and you will have renewed vigor to go back and read and repeat the cycle. Trust me, it's very, very beautiful. Okay, how to clear the doubts? You have multiple sources to create clear your doubts. Okay, go to the teachers in college, approach some faculty of your coaching platform, or ask ChatGPT. Okay, but I would sometimes not encourage you to ask ChatGPT, because it kind of gives you wrong answers at some points. But treat your notes, okay, as the holy grail. Okay, a lot of these doubts, if you go just visit your notes again, no, you'll get a new clarity. Okay, next, mind over matter. Handling stress is such a important thing in your preparation that people ignore. Okay, anxiety kills more ranks than lack of knowledge. Like I told you, you should enter the exam hall very confident that I know everything. Okay, I am going to tackle whatever is thrown at me. My enemy throws spears, arrows, whatever, I am going to handle it. Okay, your brain is the sharpest scalpel. Keep it calm. Okay, it is human to forget and make mistakes. Okay, we keep undermining ourselves right from whatever year we are in, be it first year, and you read BDC or Vishram Singh, and then you don't know the origin insertion of a muscle. You tell, oh my god, I'm such a waste. I'm not able to remember anything. It is human to make mistakes. Okay, please realize that. And the compounding effect is there. Okay, if you are going to feel I'm worthless, Okay, it keeps compounding and you're going to feel 10 times worthless very soon. But if you're going to feel, I am confident, I can do anything, you're going to be 10 times confident very soon. Okay, please focus on your health. Okay, a lot of us just ignore health totally when we are chasing some goals. Okay, but sleep and exercise and have good food, and you don't need to explain to anyone that I need my time to study, I'm doing so and so things for my goals, and you don't need to explain to anyone. Okay, if you feel a need to always continuously explain to someone, that means they are your anchor and they are not letting you to grow. Okay, don't have any obligations. If you feel I have unfinished targets and I have to skip a party today, and if someone's going to make a big fuss out of it, it's okay. You have no obligations to attend that or nothing to explain to them. Okay, stay away from drama, please. Okay, because NEET itself has taken the center stage as the biggest drama. You can't afford to have more drama in life, right? And confidence, there are enough people to pull it down. Okay, a lot of people will tell you you can't do it, or what are drinking is crazy. Okay, please, you also don't join that list. Okay, you are going to always be like, I am confident, I can do it. If I can't do it, who else can do this? Okay, that's the confidence. The toppers' secrets and common pitfalls. Toppers aren't superhumans. Okay, they're super consistent humans. So, how's the quote? Let me know. Okay, so learn from their wins and avoid their mistakes. So, a couple of points that I feel toppers do is eat the frog. You shouldn't be scared of eating the frog. Okay, please don't take it literally. I'll explain to you what eat the frog means. So, eat the frog is a concept, okay, which tells tackle the most difficult thing that you think the first. Okay, among 19 subjects, if you feel anatomy is the subject I'm scared of most, no. Even if you finish 18 subjects, you will not be confident you can give a good NEET if you're weak in anatomy. Okay, so anatomy is probably like your keystone, which will build your confidence. Okay, so realize that weak subject and tackle that first. Okay, put in your effort and trust me, if you can't do it, who else can? That's the confidence I need from you all. Okay, tackle it and move forward. Okay, life will seem so much more simpler. Okay, one final source. This I have always been telling you, have a skeleton notes, add everything to that one source. Okay, be it from any platform. I am not promoting any platform here. It can be from any platform. Okay, but have one final source and close to the exam. Please do not add any new information. Okay, and then one more point I would like to tell you in how to use QBanks is in some platforms, okay, you get analysis where they tell you how many of the people who are attempted this have got the question right. So if the percentage is as less as say 10% have got it right, that means that topic is not an important thing at all. 10% people would have got it by luck also. Even by luck, 25% people will get it because there are four options. But even less than that have got. Don't go and add that to your notes. It's just a waste of time. If you keep adding like this, no, then you will write one more Harrison. But you're not going to get any credit out of it. Okay. So consistently doing the right thing. Okay, not just consistency. If you're consistently doing the wrong thing, you're compounding yourself and digging your own grave much faster. Okay, figure out the right thing fast. Okay, and consistently do the right thing. Right, planning is very very important. Okay, this is one of my favorite quotes. Don't just meet the deadline, beat the deadline. Okay, if I am going to think I'm going to finish so and so goals within 1 week, try finishing within 6 days. Okay, your confidence is going to boost up like anything. Trust me, this is oh my god level of confidence. Okay, and don't try to be a perfectionist. Okay, it's human to make mistakes. Okay, and making notes, don't try to be a perfectionist. Underlining everything with a scale. Okay, and highlighting it with the best colors. Okay, but don't try to be a perfectionist. As long as it helps you prepare in the most smart and efficient way, you can go for it. But if you feel it's going to pull you down in the long run, stop it right now. Okay, don't be a perfectionist, right? One more big thing that I want you all to remember is NEET or INICET or whatever exam for that matter. It's one small but important speck in your grand tapestry of life. Okay, it's like it can be as small as a bindi on the portrait of a beautiful woman. Okay, it has its own importance, but also it is quite small. Okay, So don't fret over and stress over it a lot. At the same time, give the effort that you need to succeed in it. Okay. Start testing yourself today. Okay. As I told you, testing yourself before the actual test is learning. It is not testing. Okay. Start testing yourself today. Dare to fail in private so you don't have to fail in public. Okay. Think about it. So, knock, knock. Who's there? Exam. So, how will your reply be? Okay. Your reply can be, I am the danger if you're ready, or it can be exam who if you aren't. Okay. So, what do you do very close to the exam is what I'm going to address now. The last lap decides the winner. Okay, it doesn't matter what lead you have in all the 80 different labs that you have done. For the last one or two labs that you're going to, go forward, it matters a lot. Okay. So what you do close to the exam is nothing, just this one line. The second point that I've written, no, one line is your mantra for the last 1 or 2 months of your exam. Revise, recall, relax, repeat. Okay, the relax part, please focus. You have to relax. Okay, don't keep thinking too much. Just relax. Okay. One more thing I would like to tell is very close to the exam. Say if you have just 1 week before the exam, please don't do things like active recall. Okay, it's going to take up some time. At that point, trust yourself that you have a very good idea of all the topics that needs to be known. Okay, and just superficially go through your notes that you have done. Okay, your brain needs to be warmed up. That's all you need to know. You don't need to know new info. You don't need to actively recall nothing. Okay. War, postponements, COVID, or Trump, they're not in our hands. Okay. So we shouldn't worry too much about the things that are not in our hands. Right. Postponements can happen, and trust me, it is very difficult to get back on track once the exam is postponed. It is not at all easy. Okay. And I really wish that doesn't happen to any of you guys, but you have been seeing every year there is postponement, so please be ready for that too. Okay. So what do you do if the exam is postponed? How do you get back to it? The prep. Okay. If the exam is postponed, take your time. Okay. Relax for a while until the new date is announced. Till then, I would tell you don't touch any book at all. Okay. Just chill. Okay. Don't even think about the exam. Okay. It's very hard to do it, but that is going to help you a lot. Once the exam is announced, no, start planning with your remaining days. What are you going to do? Okay. Keep your plans as realistic as possible so that if you don't meet your scheduled plans, you would feel bad. Okay. Keep it as realistic as possible just before the exam. But before that, try to keep the plan as complex as possible. If you aim for 100, you will reach 80. But if you aim for 60, you will reach 20. Okay. That's the logic. No new source, no new info, very close to the exam. Okay, I think this is a quote by Bruce Lee. Okay, so he's told, I am not scared of a guy who knows 1,000 kicks. Okay, I am scared of a guy who has practiced one kick 1,000 times. Okay, think about this again. Okay, one more philosophy, a quote. So, your entire prep is to be clear with what to do in the last mile of the exam. Okay, the notes that you're preparing, okay, all the volatile things that you're doing, you cannot read a volatile thing 2 years before the exam and expect to know it on the day of the exam, just 2 years later. Okay, but if you're going to put it in a source where you're going to readily, recall and revise it just before the exam, that is what you're preparing for all the years before that last mile of the exam. Okay, the 20th notebook is for the last mile, but the super volatile list is for the last centimeter of your prep. Okay, the super volatile list can be simple things like simple but very volatile things like some classifications, criteria for sepsis, QSOFA score, okay, or GCS or APGAR, a lot of things. Okay, this should go into your super volatile list, and again, it's a very personalized list. Okay, I can be very confident with GCS, someone might not be. Okay, I can be not so confident with say a Bismuth Strasbourg classification, or someone might be. Okay, so I need to add those things in the super volatile list, only those which I feel I'm weak in, because this is for the last centimeter. You cannot do so much in the last 1 centimeter. You have to be very specific on what you're adding to it. Okay. So with that, I've come to a end of this what I need to tell you guys. Okay, I've tried to concise and be very specific with what I want to tell you, and I will be elaborating on a lot of these things in coming videos in my YouTube channel. So please do subscribe to that so that you get the best use of it. And let's go forward with our Q&A session. Before that, I would like to tell one more. Oh, we are spot on time, 8:59. Damn, I'm so proud of myself. So, exact 45-minute masterclass is 45 minutes. Damn, so happy. Okay, so before we get on to the Q&A session, no, I just want to show you one more slide, one very favorite quote of what I want to follow, and I have been following is it does not matter when you're ready. Okay, it matters that you're ready. Okay, someone might be ready to give the NEET PG exam even before out of internship. 1 year before NEET PG exam itself, they'll be ready. Everything they would have studied, and people exist like that. They're very gifted people. Okay, and we might be there, not even ready with 5 subjects. Okay, then beginning of internship, but both of us are going to give exam on the day of NEET PG. So it does not matter when you are ready to give NEET PG. It just matters that you're ready to give NEET PG. Okay? Think about this quote too and, you know, get back to me. Okay, let's have a Q&A session.
Sir, I'm in my third year of MBBS, sir. I'll be giving my university exam in the month of November.
Hmm.
Sir, and we have only two subjects, that is ComEd and Forensic this year.
Okay.
So, like, how do you expect us to start the preparation? Or, like,
So yeah, I think two batches have this like this, right? The ENT and Opthal have gone to the final year. So
yeah,
I would say third year just being spent on, I think, combat and forensic is what you have, right? In third year.
yes, sir.
So entire third year being spent on just those two subjects, I don't think is the best thing. But you also need to remember that third year is the year in your MBBS where you're going to enjoy the most. Okay, so don't compromise on enjoying. Enjoy the most. Okay, go to all the fests that our college allows you to. Okay, and make sure that you find some time. Okay, and I would recommend you if you can finish at least ENT and Oftal on a decent level. Okay, and if possible, you can go forward and read medicine, surgery, or OBG, that all the topics that you have in your third year, right? So those things you can finish. That's what I feel.
Hi. So first of all,
Yes.
congratulations on
I
your rank, and
thank you.
for
Thank
the
you.
thank you for the amazing session.
Thank you. I hope you liked it.
Yes, we did. I wanted
Mm.
to ask you, like, in the beginning, you mentioned about like around 300 topics, which are like very important, like overall. So,
Yes.
I'm in third year, and I don't really know like the fourth year subjects, like
Mm.
what exactly are important. So, as a
Mhm.
student, how did you approach? Like, how did you get to know that this topic is important or it is not important? Like, how did you come up with that?
Okay, I got the question. So it's like I'll give you an example and I'll deal with this. So when you're starting to, study a textbook, right? What I follow is I will not highlight anything in my first read because I know in my first read I don't know what is important, what is not important. So there are high chances that I might highlight something not important and I might leave out things that are important. Okay, I will get to know these only once I read the first read and I go to my second read, and by then I should have had an exposure through Q banks or college internals or mock tests or somewhere, and see that certain topics are repeatedly being tested. Okay, at least they are being asked that you'll know. Okay, so with respect to your question, okay, these 300 topics I'm telling you is for NEET PG. Okay, so you as a medical student and have to become a doctor, right? You need to spend your 6 years of MBB, close to 6 years of MBBS in becoming a good doctor. So the ideal thing is to read as much as possible. Okay, but specifically for NEET, you will know those important topics only when you finish a general read of the subject. So in third year, if you have to know the important things in OBG, no, it's quite difficult. Okay, and I wouldn't even recommend you that you only study OBG those important 10 to 15 topics. Read entire OBG, and then the second round is when you start preparing for NEET PG. That is when you are going to select out those 10 to 15 important topics that are repeatedly being tested and get the best mastery out of them. Others are good to know topics.
Firstly, congratulations, sir, for this amazing achievement, and thank you so
Thank
much for
you.
taking your time out to actually prepare so much for us. I think
Thank you.
like
Thank you.
it's
Thank
in
you so
all of
much
our
for your
mind.
effort, help on these techno and logistic issues. Thank you so much.
Anytime, anytime. So I think overall it definitely clarified all the questions I had, and as a student in third year, there's like no idea on how to start, when to start, and I think everything has been so beautifully clarified. And most of all, I really loved the presentation and the motivational quotes that you put everywhere. So it was really, really boosting confidence and motivational. So thank you so much for that.
How did you balance revising what you already knew and
Hmm.
covering new topics? Like it tends to get piled up when you're approaching exam, right?
Yes, yes, yes.
So how did you balance that?
That's what I addressed with spaced repetition technique. Okay. So spaced repetition, when I told you that you have to spend, like 1/10 of the time that you spent in studying the topic just to, review it. Okay. Review it once very fast. Okay. And then later on, when you're planning your day, make sure you keep a small chunk of it to revise something you feel you're not confident with. Okay, a lot of times you might not know what you're not confident with, so it is always better to have a schedule where you are having you know a list where you keep revising things you have already studied. Okay, and spend more time on studying the new things. If you feel you want to revise biochemistry, okay, a lot of biochemistry stuffs are there in pediatrics also.
Yes.
Right. For example, the inborn errors of metabolism. Okay. So when you're going to inborn errors of metabolism in pediatrics, right, the focus on NEET PG is more from biochemistry.
Mhm.
So there you can go back to biochemistry and revise that. Okay. So
Right.
this is for overlapping topics. You can approach when the overlapping topic comes. Okay. Otherwise, you have to make time and read things which are core those subject topics. There can be core physiology topics which you might not find anywhere else. Okay, you
Mhm.
have to find time, and the strategy can be different. You can solve questions and get it done, or you can see your notes again and get it done. It's up to you.
During the exam, like what was your approach when you got stuck between like two options when you have eliminated the other two? Like
Right.
how did you approach that?
So my approach was I had a very aggressive approach because it's like if you have 200 questions
Mhm.
and if you're kind of sure with only 120 questions, you cannot leave 80 questions unanswered and come, because even if you get all 120 questions correct, you're not going to get a very good rank. Okay, so and there are questions, especially in INICET, there are a lot of questions where you're not sure with the answer. Okay, so you're going to rule out two options and you're going to be left with two options. That is the best case scenario. Okay, the worst case scenario can be you don't know any options. That's where the intelligent guessing part comes. I personally, if you ask me, if you have ruled out two options, go for it because you have a 50% chance of getting it right.
Yeah.
Okay, and me being a more aggressive person, I used to go for it even if I can rule out one option. Among three, I'll try to make an intelligent guess as if it's a question where all four options are not clear. Okay, among three options, I'll try to eliminate something and get it.
That's a
Okay,
gamble.
it is a gamble because exams like INICET more so. Okay, is a very luck based and gamble based exam. It's a brutal exam. Okay, and it's not going to necessarily see who has studied well or not. It's going to see who has approached the exam well,
Right.
who is ready to gamble, because that's how life is going to be as a doctor in future also. At times you won't be very confident with the decision you're taking,
Right.
but you need to take the gamble because a patient's life is at stake. Okay, so it's also testing your gambling skills.
Yeah,
You can
thank you,
try all these
sir.
approaches when you're giving your grant test so that you don't try it on the day of the exam.
Yeah.
Okay, as I said, grant tests are all learning tools. That's where you do the most mistakes and learn.
Thank you, sir, and congratulations.
Thank
And you're
you.
gonna be a great surgeon, definitely.
Thank you. Yeah, all the best to you too.
Thank you, sir.
Vignesh, huge congrats to you.
Thank you, Bhuvan.
Yeah, and thank you so much for taking this initiative of helping the juniors with all
It's my
the.
duty.
Yeah, thank you so much for that.
Mm.
So I have a question.
Hmm.
With you as a like a role model, like if we want to achieve the
Yeah.
same rank as you have gotten, what should
Ah.
be like if you could if you are comfortable to tell us what were the number of corrects you got in when you took a
Hmm.
GT in end of final year, in the beginning of internship, in the middle of internship,
Okay.
in the end of internship, and
Ah.
just before the exam.
Okay. So first of all, I'll start answering a question by telling, I wish you get a much better rank than mine. Okay. So,
Hopefully.
and yes, and I hope you will. And with respect to the GT corrects, it has. So I started giving GTs probably in my third year. Okay, and I used to get somewhere around 90 to 100 questions right. Just like 50% of 200 questions. Okay, that was how I started. And I would tell I started late because I would even tell you guys to attempt GTs in the beginning of third year. And there you might even get 60 questions right or less than that also, but it shouldn't demotivate you. Okay, so that's what happened in third year. And final year, I made a mistake of not giving so many GTs. But as and when I gave, it used to hover around 100 to 110. Okay, and internship time, it kind of hit a plateau because I was totally confused what to do next. Okay, so the plateau was around again 110 to 120. So it was a very gradual improvement over many years. Okay, and I would tell you that I have not seen any GT where I've got more than 150 corrects. 150 correct is the maximum I've got. And this is in Marrow GTs. Okay, Marrow GTs are known to be on the tougher side. So the ones who are using Marrow, I would tell you, please don't get demotivated seeing Marrow GTs. NEET PG is far, far, far easier than Marrow GTs. Okay. So Marrow GTs, the maximum I've ever got is 150. I was always hovering around 130 to 140s. So that's what happened.
Thank you so much, bro, for answering this question. And I'm sure you're going to become a great surgeon in the future.
Thank you.
Congrats. Thank you.
Thank
Thank
you.
you.
All the best to you too.